Who is eligible for the Medicare Bridge GLP-1 program? This is Dr. Jonas, an endocrinologist with 30 years of experience, reviewing eligibility criteria clinically for patients. The program has launched July 1st of 2026. There have been some hiccups in the road, and it's a good time just to take a reminder of who is eligible for the program, what medical issues, what weight do you have to be in order to qualify for the program. So first of all, you have to be an adult who's a Medicare recipient over the age of 18. If you have a BMI of 35 or higher, you qualify for the 4 medications involved in the program without having any other additional medical criteria. And again, just a reminder, the 4 medications are the pill called Foundeo, a pill called Wegovy, the Wegovy pill, the Wegovy injection, and Zepbound injection. Those are the 4 GLP-1 medications in the program. So again, BMI more than 35, you qualify. If your BMI is more than 30, then you qualify for different conditions. One of them would be having diminished kidney function. And if you're familiar with your chemistry panels that test on your blood reports called a CMET or a BMET or a comprehensive metabolic or basic metabolic, you'll see something called the GFR or an estimated eGFR. It's a measure of your kidney function. If it's diminished, if it's 59 or below, and your BMI is more than 30, you qualify. If you have uncontrolled blood pressure, what defines uncontrolled blood pressure? Either higher than 140 or higher than 90 on 2 medications, and your BMI is more than 30, you qualify for the program, for the 4 medications for weight loss. If you have congestive heart failure with a preserved ejection fraction, that's a lot of words, and I don't expect you guys to know that at home, you qualify with ejection fraction greater than 30. Interestingly enough, I used that diagnosis just in the last day or so to submit a patient for the medication. I had a beautiful consultation note from the cardiologist who went through all the patient's medical problems, and he outlined that diagnosis with great detail and made it pretty easy for me to feel comfortable that that's what the patient had. So again, that's congestive heart failure with preserved ejection fraction. Now, patients with BMIs 27 and higher, so that's not obesity by the BMI criteria. So again, body mass index is what I forgot to tell you, that's what our BMI is. It's a height and weight calculation. It's a way of establishing body mass, and it's how the criteria that we use for most of our weight loss medications. So we're not going to argue whether you feel it's accurate or not accurate. That's the criteria. We accept it. We go with it. So if your BMI is 27 or higher, you qualify if you're a pre-diabetic by the American Diabetes Association criteria. That's hemoglobin A1C 5.7 to 6.4, fasting glucose 100 to 125. Those are the basic stuff you'll find in your chart that'll let you know that you qualify. You also qualify if your BMI is 27 or higher and you've had a heart attack, or you had a stroke, or you have symptomatic peripheral arterial disease. So those would be other criteria by which you'll qualify. Now, interesting, one of the problems we've run into in this early couple of days is who doesn't qualify. And if you have medical problems that allow you to get these medications through a different pathway, that pathway is supposed to be the traditional Medicare prescription Part D pathway. That includes if you have diabetes. If you have diabetes, you can get medications that are similar to these medications, and you shouldn't go through the Obesity Bridge program. If you have fat in the liver, metabolic liver disease with scarring, fibrosis by an F2 or F3 score, you're eligible for the Wegovy injection. You're not supposed to go through this pathway. If you are trying to prevent cardiovascular disease with known cardiovascular disease, you also can be eligible for the Wegovy pill or the Wegovy injection. You're not supposed to go through this pathway. But that's kind of interesting because, as we said before, if your BMI is 27 and you've had a heart attack or a stroke, then you, or you have symptomatic arterial disease, you qualify through the Bridge program. So a little bit of overlapping lines there. Also, if you have moderate or severe sleep apnea, you qualify for Zepbound. And you're supposed to go through the traditional Medicare Part D pathway, not through the Bridge program. Again, some of the things we've run into is that there's an overlap with these disorders. You may have had patients who have tried a medicine, didn't do well with it, and now want to go to the obesity program, or there's an issue with one medicine, they want to be on another medicine. So these are some of the things that will occur in live time, and I'm sure will get resolved soon. But it's important to know who qualifies, what medical problems you have to have, what your BMI has to be with those medical problems. Another thing that we can't forget is, although it's confusing, there's Medicare, we know that, but traditionally we've gotten our medicines through Medicare Part D over the years. This is a Medicare bridge program. It's kind of like a side program, a side track that's not going through Medicare Part D, but it is administered by Medicare, but it's not going through traditional Medicare. So it's important to understand that it has a different set of rules for payment and other features. So hopefully that's helpful, just as a reminder who qualifies for this program.